fighting back. In an ideal scenario, you stop a pandemic by never letting it start. When new infectious diseases emerge, you stamp them out before the numbers get too high. In this process, which is often called containment, you conduct widespread testing so you can find out who's sick and promptly identify local outbreaks. You then quarantine everyone who's sick and do contact tracing, which involves locating and carefully monitoring the health of the sick person's family, friends, and colleagues. But once you've got community spread, or the transmission of the virus to individuals who haven't traveled to known virus hotspots or had contact with anyone who's sick, you will likely have to move to a strategy of mitigation or suppression. Mitigation tries to slow the spread of the virus while isolating people in high-risk categories, while suppression subjects everyone to isolation measures in an attempt to drive down the overall rate of infection. Mitigation and suppression are difficult and complex strategies to implement. The basic principle underlying both, though, is simple. You make it harder for the virus to pass from people who are infected to people who aren't. By strictly following this principle, we could end the COVID-19 pandemic very quickly. All we'd need to do is force everyone in the world to remain in complete isolation for 6 weeks and prevent them from going out for any reason whatsoever. That way, the virus would die out because an infected individual could only transmit the virus to people they were quarantined with, and 6 weeks is likely enough time for the virus to pass through an entire household. But draconian measures like this aren't practical or ethical. An alternative approach is based on building up herd immunity, or getting to the point where so many people in a community are immune to a virus that it's really hard for a virus to find new hosts to infect. One way you can reach herd immunity is by letting lots of people fall ill. This works because, generally speaking, when people recover from an illness, they remain immune to reinfection, at least for a while. The percentage of people you need to be immune varies by disease. For a highly contagious disease like measles, herd immunity requires levels as high as 95%. While COVID-19 doesn't appear to be that contagious, modeling suggests you'd still need at least 60% of a community to be immune for new cases to drop to very low and easily manageable levels. But going quickly from 0 to 60 would likely prove catastrophic in the case of COVID-19. Estimates of the percentage of people infected with the COVID-19 virus who die from the disease have been all over the place, with reports of death rates as low as 0.3%, comparable to seasonal flu, and as high as 11%. Such variation is not unusual in the early stages of a pandemic, when vastly different levels of testing are one of several variables that complicate attempts to calculate a precise death rate. But even if the lower estimates of the COVID-19 death rate are accurate, allowing the virus to spread unchecked in large, densely populated countries could result in hundreds of thousands of deaths and even greater disruption. That's why there has been such interest in the development of a vaccine. Basically, a vaccine exposes an individual to a very small or inactive part of a virus in order to teach that individual's immune cells what to do when they see the real thing. Vaccination is a safe and highly efficient way of getting a community to herd immunity. But there's a problem. It usually takes several years to develop and make widely available a vaccine that works and doesn't have major side effects. There are some grounds for believing that we'll have a COVID-19 vaccine quite a bit sooner than that. But in the early stages of the pandemic, even the most optimistic estimates suggested we were at least 12 to 18 months away. And it was this lack of any realistic prospect of a vaccine in the near future that led to so much talk of a concept you'd probably never heard of before March 2020, but are now no doubt very familiar with: flattening the curve. The curve we're talking about is the one showing new infections, and flattening it means lowering its peak. One of the big things to understand about flattening the curve is that it's not just about reducing the overall number of people who get infected with the virus. It's also an attempt to slow the rate of transmission so everybody doesn't get sick all at once. And this is really important because the percentage of people who die from COVID-19 is not a static property of the virus. On the contrary, the percentage of COVID-19 sufferers who die will be greatly affected by how prepared healthcare systems are to treat the ones who require hospitalization. It's a simple concept. If you only have 50 ICU beds, you don't want 51 patients who need an ICU bed, and you don't want doctors and nurses working unsafe numbers of hours or treating sick and highly contagious patients without adequate personal protective equipment, or PPE. The more pressure there is on all aspects of a healthcare system, the more likely it is that very sick patients, whether they're sick with COVID-19 or something else, will die. But flattening the curve is also about buying time in another sense. As doctors treat patients and as researchers analyze data, there is a growing opportunity to understand the COVID-19 virus and determine which treatments are most effective in saving lives, preventing lasting damage to vital organs, and nursing patients back to full health. Other things being equal, it's much better to get ill months into a pandemic than right at the start. There are many ways to flatten the curve. Unfortunately, there tends to be a direct correlation between how effective they are and how much disruption they cause to people's lives. At the start of the COVID-19 outbreak, many state and national governments banned large gatherings, discouraged travel, and asked anyone who could to work from home. But these measures typically didn't do enough to slow the spread of the COVID-19 virus, and deaths in many places continued to rise. So then school and university students were sent home. Recreational travel was banned. Restaurants, bars, clubs, theaters, and many stores were closed. And people were ordered to stay in their houses and leave only for activities deemed essential. And even then, they were required to engage in social distancing, or staying at least 6 feet or 2 meters away from others, often while wearing masks. Within a few weeks, large sections of the world were on lockdown. In many places, these stricter and more expansive measures proved quite effective in slowing the transmission of the COVID-19 virus, and hospitalization and death rates plateaued and then fell. Despite the observable progress, there has been resistance to almost all of these restrictions. Influential media personalities have dedicated shows to criticizing some of the more stringent ones, encouraging and then celebrating the protests that followed. The motivations of the protesters are no doubt varied and complex. Some clearly fear the harm caused by shutting down huge portions of the world economy will exceed the harm that would have occurred from letting the COVID-19 virus run its course. Others see stay-at-home orders and the like as alarming examples of government overreach. Still others just can't bring themselves to believe that something as mundane as grabbing a coffee with a friend could ever truly be dangerous, and so refuse to accept that staying home whenever possible is a moral obligation. Without a vaccine, it's difficult to see how our world can revert to normal. As we selectively reopen parts of our society, we'll need greatly stepped-up testing and contact tracing to identify and contain local outbreaks. But things will likely remain uncertain for an extended period, and it's quite possible we will alternate between extreme and moderate restrictions for months or even years. Life in the era of COVID-19 will no doubt present many challenges, but there is no reason to believe that collectively we won't meet them. The key will be getting good information and tuning out what is sometimes called fake news.